Good. Closer down to here. Yep. We'll have a full house. Secretary, please. Barb. Rep and Senator, please. The couple stand at that X. The X goes.
Hey, everybody.
Good morning.
Thanks again for being here.
I'm glad to be here. Thank you.
Means a lot.
All right, Doc, you're good.
Well, thank you. Good morning, everybody, and thank you for being here today. I'm Dr. Ed Sabani. I'm the CEO of Guthrie Clinic, and it is an absolute honor to welcome Governor Shapiro, as well as our distinguished guests, members of the cabinet. I believe we have representation from Congress or from Congressman Muser's office. Bradford County Commissioner Zach Gates is here. And I'd recognize also the chair of our board, Mr. Ken Levitsky. Ken, thank you for being here.
Thank you, Ken.
It is such a pleasure to introduce you to Guthrie. We are proud of our integrated health delivery system of care that was pioneered by Dr. Donald Guthrie of the Mayo Clinic and established in Sayre, Pennsylvania, 115 years ago. Today, we celebrate rural healthcare delivery system providing state-of-the-art care across 10,000 square miles, 13 counties in Pennsylvania and New York, offering a full spectrum of medical and surgical specialties. Our commitment to quality, safety, and experience drives us to be a national model for rural healthcare and providing the highest quality of care centered on the patient. You know, we are really proud to apply technology to expand the experience and safety of our care. Many of our population health results show us to be in the top 10% in the nation, a testimony to our dedicated primary care teams. And that is, I think, really where the rubber meets the road in terms of taking care of patients. With close to 10,000 caregivers strong in our system, our care teams are honored to provide nearly 2 million patient visits a year across a large area. An enterprise of ambulatory sites, hospitals, rehabilitation facilities, home health hospice, the entire spectrum of care. High quality, patient-centered care is Guthrie's business. You will soon hear from an amazing patient who benefited from our level 1 trauma center. You know, his story involves skilled nurses, skilled doctors, and an entire team, many of whom who grew up in Commonwealth, trained at wonderful facilities across the country, and came back home to their community. And that's a credit to that team. To provide this care, we remain laser focused on recruiting the very best care employees and talent and keeping them happy and engaged in our mission. Earlier this year, we implemented an across-the-board wage increase, enhanced benefits, raised our minimum wage, all as part of our value proposition for our caregivers. All of our caregivers are the lifeline of providing exceptional care. Rural health systems like Guthrie face unique challenges in the workforce. Due to geographic barriers, financial constraints, it can be difficult to attract and retain talent. To address this issue, we've ensured sustainable access to high-quality care by creative and innovative solutions. So, in rural areas like ours, one innovative solution is our Pulse Center, a transformative care delivery model that leverages remote support from highly trained professionals and to provide the very best care and thrive in a highly competitive environment. I want to thank you again for joining us. I want to thank Governor Shapiro for his many initiatives to develop, nourish, and sustain a rural workforce which will propel us to a bright future in the Commonwealth. And now it's my privilege to introduce Mr. Kevin Gibbs, a former trauma patient at this hospital, who will describe his experience. Mr. Gibbs.
Thank you.
Thank you so much.
Thank you, Dr. Sabani. In June of 2022, on a Harley ride with my wife, I hit a deer only a mile from our home. I was badly injured and was flown from the scene by Guthrie Air helicopter to Robert Packer Hospital, where I was placed in a medically induced coma. After a month in intensive care here, then another month at Geisinger Hospital in Danville, I spent a month at the Towanda Hospital Acute Rehab Unit before I was able to go home. Since my recovery, I have returned to Guthrie for trauma survivor events, and everyone at Guthrie shows their appreciation for trauma survivors. But I want them to know how much I appreciate the trauma team, EMS, helicopter crew, and all the doctors and nurses in intensive care. Without their heroic efforts, I would not be here speaking to you today. We are lucky to have this high level of care in this small community. I've recently accepted a position as a security officer at Guthrie, so in some small way, I am giving back to the people and hospital that saved my life. And we need this kind of dedicated workforce across Pennsylvania to save other lives. Thank you, Guthrie, and thank you for allowing me to speak today. And now it is my honor to introduce Pennsylvania Governor Josh Shapiro.
Thank you. Thank you, Kevin. Kevin, we are grateful that you are here with us, and I can tell it has been quite the journey for you, and thank God for Guthrie. Thank God for their willingness to take care of you. Thank God for what Treasurer Garrity highlighted before, the fact that we have a trauma center in this community, and we just feel wonderful that you're here, and God bless you, and we wish you nothing but good health going forward. Thank you. Thank you. I want to thank Dr. Sabani for welcoming me here today, and I want you to know that I wanted to be here today because this is an example. With all the challenges we have in rural healthcare, this is an example of a healthcare system that works. And we want to hold Guthrie up as a model for the rest of our Commonwealth, especially our rural communities, on how to make it work. How to make it work to save lives like Kevin's when there's an acute issue. How to make it work when it means giving people the opportunity to work in a wonderful environment where you can not only make a great wage, but as we talked about before, you have a wonderful culture and a great place to be working with wonderful colleagues. We want this to be a model for how to deliver rural health care in a Commonwealth that is challenged right now in meeting our rural health care needs. So Doc, thank you for welcoming me here today, and thank you for being a great example that we're going to hold up to the rest of the Commonwealth. We appreciate you and all of your colleagues. I want to make special note of the presence of a friend of mine, and I know a friend to many of you because she literally lives in the neighborhood, and that is our state treasurer, who's also a trustee here, Stacey Garrity. You'll hear from her in a moment, but Madam Treasurer, I want to thank you for being with us today. I think it is also important to note the presence of your senator, Senator Yaw, and your representative, Tina Pickett. We've all worked together on a number of issues, and I know we live in some polarized times, but I hope you'll note that the fact that you've got a Democratic governor with a Republican senator and a Republican representative working together to address rural health care. I think that's something we should be proud of in Pennsylvania, that we can come together to get stuff done. I'm joined today by one member of my cabinet, Secretary Davis Jones, who leads the Department of Drug and Alcohol programs. Secretary Davis Jones has a unique initiative that has worked to recruit and retain the talent we need in the healthcare space. She'll speak about that in a moment, but it's a pleasure to have Secretary Davis Jones with us here in Sarah today. So thank you, Madam Secretary. We pride ourselves in Pennsylvania on coming together to solve big problems. I know that folks get frustrated sometimes when they see problems that seem to linger on and on and on. Here in our Commonwealth, we believe it is our job to find ways to come together around common sense ideas to deliver real results that make a difference in the lives of Pennsylvanians. We've done that together in so many different spaces, whether it's public safety or helping our seniors, just as two examples of where we've come together to manage to pass legislation that lifts everybody up in rural, urban, and suburban communities. I'm proud of the fact that we've been able to do that, but I'm also mindful that we've got a lot of other problems to solve, and rural health care is chief among them. We've got a strong foundation of cooperation and collaboration to build upon. And we've got great examples like Guthrie who can help us find answers to these pressing problems that we see all across Pennsylvania. One of the biggest challenges I think we face as a Commonwealth is around workforce shortages. Now, I want to be really clear, workforce is different than employment. In fact, more people went to work in Pennsylvania today than at any other time in our nation's history. Our unemployment is at historic lows. That's really something we should be proud of today. But we have a responsibility to be focused on what the challenges are for tomorrow. And that's the issue of workforce that we are investing so much time and resources in to address workforce shortages in really critical sectors. About a month or so ago, I introduced my budget to the people of the Commonwealth. It's a budget that was introduced that is balanced, it makes critical investments, it cuts taxes, and it maintains a healthy reserve. And it's a budget that now goes to the members of the General Assembly for them to consider, for them to put their stamp on, for them to put their views and values on, and then eventually we'll come together and compromise and move our Commonwealth forward. One thing that is clear throughout my entire budget is that it places a special emphasis on workforce development, on making sure that we shore up those areas that are struggling without the necessary personnel. And one of those key areas that my budget invests in is on rural health care and making sure that we've got the personnel we need in our rural communities to keep people healthy and safe. That means we need more doctors and more nurses, more mental health professionals, more addiction specialists in our communities, especially our rural areas. Consider this for a moment. More than 850,000 Pennsylvanians, and there are 13 million Pennsylvanians, so we're talking about a big chunk, do not have enough health care providers in their communities. Senator Yaw mentioned in our meeting before, we have one county, Sullivan County, that doesn't even have a physician available for people in that community. And we're seeing a real challenge all across Pennsylvania that is distinct to rural communities. Consider this for a moment. In our urban areas, you have one practitioner for every 222 residents, pretty decent ratio. You go out in the rural areas, we have one primary care doc for every 522 residents. That's not okay. And when you factor into that, then in rural areas, it just takes longer to get places, and you've got fewer healthcare providers, primary care docs. That is a real problem. Nursing is another area where we have a real challenge. Statewide, 14% of our, we have a 14% nursing job vacancy rate, 14%. That is one, and in rural communities, the percentage of unfilled nursing jobs is 26%. So 1 out of every 4 nursing jobs is vacant, goes unfilled in our rural communities. The good news is Guthrie's got a plan that we want to emulate across the Commonwealth to make that better. If we do not act now, those trends are only getting worse. By 2026, if we do nothing, we are expecting to have 20,000 nursing vacancies across Pennsylvania. In that same year, Pennsylvania is projected to have a shortfall of more than 6,000 mental health and behavioral health care professionals. Now is the moment to take action. Goes back to what I said a moment ago. This is not an employment challenge. This is a workforce challenge. And it's on us to plan for a future right now. And so that's why my budget takes concrete steps to recruit more healthcare providers and incentivize them to work in great communities like Sarah all across Pennsylvania to ensure that every Pennsylvanian, no matter their zip code, has access to healthcare professionals in the communities that they love to live, work, and play in. I think it is not new to us in Pennsylvania to address workforce challenges. We knew, for example, that we didn't have enough state troopers. We invested in them, and we've already increased our complement by 800. We knew we didn't have enough municipal police officers. We invested in them through our budget process, and we've added 700 more. You might ask, why is this guy talking about policing when we're supposed to talk about rural health care? It's an example of how we've come together with financial incentives to increase the personnel we need to keep us safe. Here's another shortage we face. We don't have enough teachers making their way into the classrooms. Yet we came together on a bipartisan basis and passed a teacher stipend initiative, student teacher stipend initiative, to pay student teachers to get them in the classrooms to educate our kids. And we're beginning to see the trend lines change, bringing more teachers into the classrooms. I cite that as two examples of where we've come together and made progress. Now the next challenge is rural health care, coming together to make critical investments to do that. And we have models to build upon. I want to talk about what Secretary Davis-Jones has done. Under her leadership, she has worked to offset student loan debt for 675 trained substance use disorder treatment professionals in Pennsylvania, and then after paying off their student loans, incentivize them to go work in communities that did not have enough professionals. You'll hear more from Secretary Davis-Jones about this work. But here's the thing, I'm a common sense guy. If we're doing something that's actually working, getting more cops on the beat, more teachers in our classrooms, more substance use disorder professionals in our communities to treat people who are battling the disease of addiction, we need to do more of that. We need to build on those initiatives that work, particularly initiatives that don't cost a lot, but have a real impact on our lives and our communities that are struggling. So this budget takes that successful model from DDAP and builds up on it. I'm proposing 3 concrete steps to address workforce shortages, especially in our rural communities. First, we expand the loan repayment model to apply not just to substance use disorder treatment professionals, but all mental health and behavioral health professionals across Pennsylvania. Second, my budget creates a new loan repayment program specifically focused on healthcare professionals who take jobs in rural communities. I want to build a stronger pipeline of healthcare professionals to places like Bradford County, all across the northern tier and other rural areas that are struggling. My budget does that by paying off the student loan debt for doctors who agree to serve at least 2 years in one of those rural communities. Third, my budget strengthens the partnerships between hospitals and nurse education programs that guarantee nursing students jobs once they graduate. Let me explain briefly how this works. Hospitals all know they need more nurses. You're going to hear about that in a moment. So they partner with local nurse education programs to offer guaranteed job placement programs to nursing students after they graduate. The hospitals get a guaranteed workforce trained nurse to fill a job, and that nurse gets an opportunity to fulfill his or her dream to be a nurse and help their communities. Nursing students have the peace of mind knowing that they're going to have a place to land at a wonderful salary, and they get help covering their tuition in the meantime. Altogether, these components of my budget will create a stronger pipeline of well-trained nurses taking jobs in local communities. Guthrie is already doing this work, and I know that public sector help is important to them, but they're also managing to do this on their own, which is really admirable. We want to take this Guthrie model and expand it across Pennsylvania to do more. I think this is a hospital that has obviously a very long history, more than a century old, one that has had to change and adapt over many years, and a lot of change here in the northern tier. And yet, the spirit of innovation lives on at this wonderful healthcare institution. And it's that spirit of innovation we need to drive change in Pennsylvania and challenge us as policymakers and leaders in the Commonwealth to do even more. So we are here to be partners to you at Guthrie and here to lift up the example that you're setting for the rest of our Commonwealth. Listen, healthcare staffing shortages in rural areas is not unique to Pennsylvania. We see this all across the country. But I'll tell you something, here in Pennsylvania, we know how to come together and solve problems. And this is the next big problem we need to solve, and working together, I know that we can do that, working together in a bipartisan manner, working together with the private sector, listening to healthcare leaders and experts like you have here. That's going to help us solve the problem and continue to get stuff done here in the Commonwealth of Pennsylvania. So I want to thank you all for being here today and giving me an opportunity to share my vision. And thank you for bringing me here today to educate me on the Guthrie Way so that we can continue to expand that across this Commonwealth. And now it's my pleasure to bring up the aforementioned Secretary Davis Jones to share some thoughts about the work that is happening at DDEP and how that can be a model for more of our work across rural Pennsylvania. Thank you all very much.
Thank you, Gus. So good morning, everyone. It's an honor to be here today. I am Dr. Latika Davis Jones, Secretary for Pennsylvania's Department of Drug and Alcohol Programs. First, I want to thank the governor. I just want you to know that I'm proud to serve as part of your administration leading the state's response to the overdose and opioid epidemics. You've often said that addressing crises takes all hands on deck. Today is a perfect example of that commitment, working together to tackle the root causes of the challenges we faced. We are not just talking. I'm going to use your term.
Yeah.
We are getting
Use the G-rated version.
right.
Yeah.
Stuff done,
Yeah.
right? We're getting stuff done. And as the governor has said, he has big plans to take the success of my department and replicate it elsewhere. Here's how. First and foremost, we know that burnout is real. The people on the front lines of the crises, that our healers and helpers, are carrying a heavy load. They are saving lives, but they need support too. One way the Shapiro administration is stepping up is through my department and our student loan repayment program. This program helps to ease the burden of education costs, especially for those working in rural communities where the need is great, and it's making a real difference. Last summer, Governor Shapiro and I sat down with some of our student loan repayment recipients, people working in detox, social work, case management. We heard powerful stories, good news stories. One social worker told us that loan repayment program actually helped him to pay off his student loans, and now he has the ability to pay for his daughter's tuition without taking on more debt. We also talked to a detox manager who said she nearly fainted when she learned that her student loan payments would be completely wiped out. With that weight lifted, she's now focused on earning her clinical license in social work. Loan repayment works, and we've got the data to prove it. When we surveyed the first group of student loan recipients, 98% of them said that they are more likely to stay in the field because of this financial support. 85% said that the program increased their job satisfaction. So why wouldn't we try to replicate this program in other healthcare spaces? Loan repayment works, and I'm confident that it can work across various healthcare sectors and in places just like this. And with that said, I am proud to introduce one of our loan repayment recipients, Barb Vanaski, who is here to share her story as a student loan repayment recipient under the Shapiro administration. Barb? Yeah. Let me take this.
Thank you. Good morning. Thank you, Governor Shapiro, Secretary Davis Jones, and the Department of Drug and Alcohol Programs for the opportunity to be considered and awarded the Substance Use Disorder Loan Repayment Program. My name is Barb Vanaski. I'm a licensed clinical social worker, and I've been working in the field of substance use disorders for 12 years in rural Pennsylvania, serving Lycoming and Clinton counties. This loan repayment has afforded myself and several other social workers the privilege to continue to serve our communities without the financial burden of student loans, to focus more on what we entered this field to do, and that's to serve our communities, and in turn, help the Pennsylvania workforce be healthier and more satisfied. Governor Shapiro wants to take this successful, life-changing model and make it work in other sectors. it would assist healthcare professionals throughout the Commonwealth to do the same thing and paying down their student loans, staying in their jobs, especially here in rural Pennsylvania. I'd now like to invite retired Army Colonel, Pennsylvania State Treasurer Stacey Garrity to the podium.
Thank you.
Thank you so much.
Thank you, Barb. Good morning, everyone. My name is Stacey Garrity, your Pennsylvania State Treasurer, and I can't tell you how good it feels to be home right here in Bradford County. I'm here today as somebody who's concerned about access to health care in rural communities, and not just here in Bradford County, but across our Commonwealth. Now, I have a lot of personal connections to this facility, so not only because I was born and raised right up the road, 10 minutes away, I graduated from Sayre High School. I have family that works in this hospital. All of my family has been treated in this hospital. And Debbie Roppers, who we're going to hear about today, she is a dear friend of mine, and we actually, fun fact, grew up together. And that's what rural health care is all about. Members of the community helping members of the community. And that's why it's so important that we address the rural health care issues that we have right here in Pennsylvania, because there's a lot that needs to be done. Now, several hospitals in Pennsylvania's rural communities, they've closed in the last few years, and even more are at risk. Earlier this month, UPMC Cole in Potter County, and Governor, they actually do call themselves God's country.
I know.
They announced that they're going to terminate labor and delivery services, and that leads to a 6-county maternity care desert. Think about that. So something must be done. Yeah, thank you. So, so I thank
I'm a
Governor.
rural healthcare provider.
I know. So I really thank Governor Shapiro for being here today to have these discussions surrounding this important issue. I thank you for all your initiatives. I thank you for your proposals in the budget. And I thank Senator Yaw and Representative Pickett for fighting the good fight in the legislature and defending our rural communities. So a political commentator once said that Pennsylvania is Philadelphia and Pittsburgh with Alabama down the middle. Now, I like to say that our Commonwealth is Philadelphia and Pittsburgh with Pennsylvania in between. And too often, it's these Pennsylvania communities that get left behind, including with lack of access to health care. So it's my hope, and I'm very confident and optimistic that lawmakers are going to come together in a very bipartisan manner, just like we do, to get stuff done. So I want to close by thanking Dr. Sabani and your team. A lot of you are out there, a lot of you I know, for all the hard work that you do to serve our community every day. It's so important. And thank you again to Governor Shapiro for being here today. And thank you to Senator Yaw and Representative Pickett for taking up the issue in the General Assembly. And with that, it is my absolute honor to introduce my friend, your Chief Executive Nurse, Debbie Roppers.
Thank you, Stacy. Yes, we took dance classes together when we were little girls.
You can talk about that if you want.
Little girls. So Guthrie would like to thank Governor Shapiro for including $5 million, an investment in the Nursing Shortage Assistance Program in his proposed budget. This is going to make a huge difference. Students who participate in this program are from some of the best higher education institutions within the state. These students will have their tuition sponsored, and then they will work at a graduating designated health system like Guthrie following, when they begin employment, and they'll work up to a 3-year time frame with us. The program is without question effective and produces future nurses to join our over 2,500 nurses at Guthrie. To date, we have 17 nurses in this pipeline with a goal of 25 by the end of the year. And via this pipeline, we will be enhancing our workforce. We are proud to be fostering the next generation of nurses and laying groundwork for clinical excellence and leadership at Guthrie. It's my honor now to introduce State Senator Jean Yao. Thank you.
Thank you.
Good morning, everybody, and thank you for being here. This is the 23rd Senatorial District, 4,380 square miles if you're counting. 3.5 times the size of the state of Rhode Island. I'd like to personalize this a little bit. And I don't want to embarrass Ken Levitsky, but we've known each other and worked together and against each other for longer than I want to really remember. So I kind of have a personal feeling about Guthrie. I'd like to also comment that in my district, I have some of the biggest healthcare systems in the state. But I only have one that's actually located and the base is in my district, and that's Guthrie. It's here. And that makes it really a shining example. It's the epitome of, I think, of rural healthcare. I talked to Dr. Sabani, and I mean, he was trying to get me to come here. He's in my office in Williamsport last week, and I mean, he had to invite the governor to come to get me to come, and so, okay, I'm here, and we'll do it now, but in any event. I've been involved in healthcare for years. I chair the board at Penn College. We have an extensive nursing program. We have a PA program, and we talked about it earlier. They're maxed out. We can't produce enough people. That's a problem. We need to do that. We need more and more people. The Center for Rural Pennsylvania, which I'm also involved in, I think in 2014, we started a series of hearings about heroin and opioids. There's, I don't know, on the Center for Rural Pennsylvania website, there's about 100 hours of presentations about opioids, heroin, the problems that are associated with that. We had hearings all over the state. One of the other things I'd like to mention that the Center for Rural Pennsylvania did about 1.5 years ago, we released a population projection for Pennsylvania between now and 2050. And unfortunately, the numbers come out, it's almost like if you took Pennsylvania and like tilted it to the southeast. That's where population is going to go. Who's going to lose population? Unfortunately, my entire district, including Bradford County, is projected to lose population, assuming the status quo, everything that you know stays the same. So that's why healthcare is going to be, it's critical. Just think about it. When population goes down, it affects emergency services, healthcare, it affects broadband, and all those issues that come out. And I just want to tell you, I get tired of like not hearing people support rural Pennsylvania, and I will fight like hell, to make sure that that's done. And I want to congratulate the governor and thank him for coming to rural Pennsylvania, and as part of his budget to enhance the workforce or to get people to come here and stay and to provide extra money to get the help that rural healthcare needs. It's great. So with that, thank you, Governor. I really appreciate your work.
Thanks, Senator.
Representative Pickett.
Thank you, Senator. I am Representative Pickett, and thank you, as everyone is telling you, Governor Shapiro, for being here today. You are certainly in a very special place, and you're in the right place to learn these subjects that you're concerned about for all of Pennsylvania. The history, the rich history of this healthcare system is so fascinating and so enjoyable to know about, and how they've managed over the years to constantly change with the times and create new specialty offerings here in our very backyard. You employ so many people, you cover such a big region, and we are certainly very, very grateful to all of you. Certainly, having been in business for many years, I know workforce is number one. It is the thing that makes everything else work. So that the governor in this budget, and hopefully we in the legislature can follow through, are going to work on being able to do some things that will incentivize this and make it easier for systems like this to be able to attract that very talented workforce that they need. I'm grateful for that. I really am. I suspect that this is just the beginning. We probably need to go further, Governor. I don't know what you're going to
Sure.
say about that, but I think we might. He's saying, go
You
ahead.
can
put
spend
it,
more if you
put it right
want.
in there. Yeah, go right there for it. Yeah, yeah. The statistic was mentioned by the governor that this kind of shatters me a little bit, that when it comes to primary care physicians, we in the rural areas have one for every 522 people. In the urban areas, they have one for every 222 people. I will say with that, when we're here to celebrate the fact that we are able to start these programs and add to the needs for recruitment, and we're here today to talk about all the good things that Guthrie is doing with their workforce, and the fact that they just had another press conference recently to talk about the upgrades in their benefits and salaries and schedules and so on. Governor, I also do know from my local office here in Sayre that over the years, and I'll say the last 5 years, so that's not something that's been a large part of your time, but licensing in Pennsylvania has been a real snafu for medical licenses, whether it's nurses trying to get on a new job for them when they're first out of school, whether it's physicians trying to transfer. But I'll tell you what, it has been a mighty bog down on our state level. And we took it on as a project in my office to try to loosen this up wherever we could in the state and make sure that we were helping this healthcare system as much as possible. It's better, but don't let go of it, because there's still a need. And whoever on your team is the one that's watching whether we're putting these licensing systems, we need to do that like almost overnight. We have somebody who wants a job. We have a job open. Bingo, grab them before someone else does. So I'm telling you that while we're here to celebrate, we have some things, we always have more things to work on, Governor. It doesn't end, and that's why we're needed. But so I mentioned that, and the word broadband was mentioned by, I think, the senator. And when we talk about the distance and we talk about the outreach and what it takes to cover a big rural area, we love our rural areas. That's the way we want to live, but we have to have our healthcare systems be good. I hope you'll put your hand on the money that's coming into the state to make sure, from the federal government, to make certain that the right portion of it is going into unserved, underserved areas like ours. That is so important to a health system like this. They can't offer as many things as they obviously could or would like to without the customer. They may have a good system here. If the customer doesn't have it, they can't do it. I'm just pitching that, Governor.
I'm hearing you.
We need you to put your hand on that.
Picking up what you're putting down.
Okay,
here.
yeah. Whoever's out there writing for you, make sure they're making these notes. Okay. One more thing. Our EMS systems cross the state, but most certainly in our rural areas, and most certainly in my district, I'm sure the senators, they are in so much disarray. Not their fault, just the times. We need to come together as a state and say, what are we going to do with our EMS systems? I'm giving you that one too, Governor. Yeah. Okay, take that one. All right. And I know you're big on energy and the cost of it and the future of it and so forth. And I can't even imagine what the energy bills are in this facility, but in order to do what they do, in order to make ends meet every month, I don't know, is the accounting department here? They need to make those rates not only stabilized, but down.
Yes.
Down. They're going in the wrong direction. So again, I thank you very much for everything that you are doing. I thank you for being here today. You're not as far east or as far west as you could be in your state, but you're about as far north as you could go. Yeah. Do not go over into New York.
Never.
Don't do it.
No.
Sorry, New York stations, but do not. Just don't. Guthrie has business over there. Well, maybe we do need to talk about some things that are going on in New York. And I know occasionally they're ahead of us, and we don't want that.
No, we don't.
We don't want that. So make sure that you're taking care of all of that. But you want to take the podium again
Yeah.
for some
Can
questions?
I need the notes so I remember all this. I hope you all saw what Representative Pickett did there in the beginning of her remarks. She sort of gave me the side eye and raised one finger in my direction. Representative Pickett and I served together in the House many years ago. She has a quiet confidence and a bulldog tenacity about her that allows her to be an unbelievable advocate for this community. And did you also see what she did there? She gave me a to-do list while she was talking. And let me report back, because I feel like I owe it to the rep to make sure you all know. On broadband, we have enough federal money that's been allocated for Pennsylvania to connect all 246,000 homes and businesses without high-speed affordable internet to high-speed affordable internet. The challenge has been, we worked hard to get that. The challenge, by the way, has been the feds have been too darn bureaucratic. I was with the president and his administration last week, along with my fellow governors from across the country in the White House. And one of the things we talked about was loosening some of those regulations so we can get folks connected already. So we're working on it. We've got a great broadband authority. It's bipartisan, working together to get that done. You're right about the licensing. When I took over, we had a huge backlog. It took too long. We've sped that up, but we have a lot more work to do in that space, and welcome any data and feedback you have from your office. And finally, we agree with you. Here's your notes back on EMS. The budget invests in EMS, but we got a lot more to do, especially when it comes to volunteer EMS, volunteer fire. We got to do a better job of recruiting, and that's another topic for another day that we could talk about. But I hope you all saw that. The finger up, the side eye, that's a to-do list from Representative Pickett, and we're going to work on that. I appreciate she is here. I appreciate the senators here, treasurer, and obviously the team here at Guthrie. And Kevin, you are literally the reason why we do what we do. And I will say to you as well, Barb, you are the reason why we make these investments, to have professionals like you in our community doing this work. And so I'm grateful for all the people with titles next to their names, but I'm especially grateful for the two of you for the work that you do, and I'm really happy you're here, okay? Thank you. So with that, Deb has agreed to take questions from the media. No? If there's any questions from the media, we'll start with Pennsylvania, then we'll go to the New York media. How's that, Tina? Is that all right? Yeah. Go ahead. Anybody? Good? Seeing that? Oh, all right, we got one.
Yeah, how important was it for you to have this assistance in your budget and shine a light on unrepresented communities like Sayre and so many others in this region of Pennsylvania?
Look, we have workforce challenges all across Pennsylvania. They're particularly pronounced in rural communities, especially in healthcare. And so we want to make smart investments that have a huge return on investment, right? See, Barb, that's your return on investment right here. We need more of that, and we need more of that in rural communities. The reason for being at Guthrie is because this is a hospital and health system that knows how to do it right. And so I both want to advocate for the investments that the rep and the senator and I all believe in, but also to make sure that we take lessons from a Guthrie and expand that out all across Pennsylvania. Yep.
Governor, I'm from the New York side. Please don't hold that
Yeah,
against
that's
me.
okay. As long as you root for our sports teams, it's fine.
I wanted to ask, I'm sure you're aware at the federal level, the mood these days is looking to cut spending.
Yeah.
And I don't know if you have a good idea yet of the kind of spending they're talking about, what kind of an impact it's going to have on healthcare. But is that something that, as Pennsylvania looks at the initiatives you spelled out, how the federal picture might have an effect on that?
I'm deeply concerned about, what I'm hearing coming out of Washington, where they want to make significant cuts to things that all states rely on. Let's take one example, and that's Medicaid. There are 3.2 million Pennsylvanians who rely on Medicaid. That represents about 24% of our entire state population, okay? In addition to that, we expect to receive about $30 billion this year in federal funding just for Medicaid. Even a 10% cut there, and they're talking about even steeper cuts, would result in a $3 billion hit to the Pennsylvania budget. Money that is going to be very difficult for us to make up, and so instead you're going to see dramatic cuts for individuals receiving health care, and it would be devastating for health systems like Guthrie and others who take care of Medicaid patients. And there's a significant chunk of Medicaid patients in our folks who receive Medicaid in our rural communities. And so I just want to be really clear, cuts like that would be really devastating. A number of my governor colleagues and I sit on both the Executive Council of the National Governors Association, and President Trump also appointed me to a Governor's Council. Both are bipartisan. It's about, 8 or 10 of us or something on each. We are all together in the idea that we can't sustain these kinds of cuts in our states, but we also understand that if they're looking to eliminate wasteful spending, if they're looking to eliminate bureaucratic hurdles, give the resources to the state, maybe in the form of block grants without cutting funding, but just giving us more flexibility, we would welcome that. We know what we're doing here, and we want to be able to do more of it without the sort of heavy hand of the federal government making it harder for us to deliver health care, especially in our rural communities. That's just one example of the areas where I think we need to be mindful of. I want to just say in general, I'm all for cutting wasteful spending and fraudulent spending and spending that is abusive. These are tax dollars. In fact, in my budget, we focused on not just investments, but also cutting some spending and cutting taxes. We think it's important to make sure that you run a lean organization that's focused on helping people. I hope as the federal government moves forward with their budget, our congressmen and women and our 2 senators are going to be focused on making sure every penny that we need in Pennsylvania is delivered to us here and not make cuts that harm Pennsylvanians.
Cool, thank you guys.
Anything else? Okay, thank you all very much. Kevin, thank you. Thank you. It's a real pleasure to be with you.